Despite being one of the oldest cash crops grown in parts of western, central and west Nile parts of Uganda, tobacco is one of the harmful crops consumed by Ugandans. Its consumption is harmful to human health. In fact, in the next hour, 50 people are expected to die because of tobacco-related illnesses, including the deadly cancer. As a risk factor, it's expected to make a greater claim on health than any single disease. The World Health Organization reports that the worldwide death toll from tobacco use is 4 million annually. This number is far greater than the number of fatalities from all illegal drugs and alcohol combined. According to State Minister Sarah Opendi, the death toll is expected to rise to 10 million per year by 2020 or early 2030s.
However, there have been challenges in implementing that particular law. So as government, we are coming up with the tobacco control policy, which we believe will actually make it more stringent for people to smoke in public. And if areas are supposed to be smoke-free, then we will ensure that even the owners of these public places actually abide to that. Short of that, then of course we shall have enforcers who will make sure they take necessary action. The public place is supposed to ensure that they comply with the government policy.
On death occurring in developing countries where Uganda lies, the World Health Organization also estimates that there are approximately 1.1 billion regular smokers in the world, which is 1/3 of the global population aged 15 years and older. Above factors, Minister of Health is optimistic that passing the Tobacco Bill 2012, which is currently awaiting certificate of financial implication from the Ministry of Finance, is key. Although Uganda ratified the World Health Organization framework on health in 2005 and 2007 respectively, the Tobacco Bill 2012 has stalled, yet the country loses 13,500 people every year.
This bill is expected to actually be submitted to the Finance Ministry in order to secure a certificate of financial implication so that it can be tabled before the House, thereby generating debate to see that it is passed so that Ugandans can actually get a hold or control smoking in public places.
However, the members of Parliament on the Forum for Non-Communicable Diseases who are spearheading the Tobacco Control Bill are even more convinced that the bill will be passed without opposition due to the positive response from tobacco-growing areas.
The following week, we are working around the clock, working so hard to make sure that we table it in Parliament. Now, ladies and gentlemen, the Tobacco Control Bill I'm talking about, we have a mover of that motion who is the Honorable Dr. Chris Bariomunshi. Unfortunately, he is not able to be with us here. He is physically, but he's with us in spirit. Then the supporter of the cause of tobacco in Western Nile, in Northern Uganda, and the Bunyoro region are fully behind the bill. They want a law at the earliest time possible. And while we were there, we told them we have a draft tobacco control bill.
The Tobacco Control Bill 2012, if passed, seeks to regulate the manufacture, sale, labeling, promotions, advertising and sponsorship of tobacco products, including distribution and tobacco use. For Channel 44 News, I'm Florence Apollo at Parliament, Kampala.